Why do Medicare healthcare costs vary between providers? Imagine planning your healthcare budget and wondering why the bills from one doctor or hospital are different from another. It can be confusing to see such variation in costs, especially when you are trying to manage your Medicare expenses. Understanding why these differences exist can help you make smarter choices and keep your out-of-pocket costs in check. First, where you live plays a big role. Medicare adjusts payments based on regional factors like the cost of living and wages in different areas. For example, providers in big cities or places with higher living costs often get higher payments from Medicare than those in rural or lower-cost areas. This is because it costs more to operate in those regions. Hospitals that train new doctors or serve many low-income patients also tend to receive more money. So, the same service might cost more in New York City than in a small town in Nebraska. Next, the types of services offered and how providers bill Medicare can cause cost differences. Some doctors or hospitals perform more complex or specialized procedures, which are naturally more expensive. For instance, a routine checkup costs less than a complicated surgery. How providers bill Medicare also varies. Some may charge higher fees or have different billing practices, which can influence the amount Medicare agrees to pay. These differences impact both what Medicare reimburses and what you might pay out of your pocket, like deductibles or coinsurance. Medicare updates its payment rules every year through a fee schedule. This schedule sets the rates for doctor visits and other services. Changes in medical costs, policy updates, or legislation can increase or decrease these rates. For example, if the government raises the fee schedule, providers might charge more, leading to higher costs for you. Conversely, if rates are cut, your out-of-pocket expenses could be lower. How often services are used and how efficiently providers deliver care also matter. Some areas or providers may have higher rates of hospital stays or procedures, which increases overall costs. Medicare keeps track of these patterns to encourage better and more efficient care. If a provider uses resources wisely, your costs could be lower. Knowing these factors can help you plan your healthcare budget better. For example, choosing providers in lower-cost areas or those known for efficient care might save you money. Being aware of regional differences and billing practices can help you anticipate your out-of-pocket expenses. In summary, Medicare costs vary because of where you live, the types of services you need, how providers bill, and annual updates to payment rates. Recognizing these differences can help you make smarter decisions about your healthcare spending and avoid surprises when it's time to pay.